distinguished chief guests, celebrities, star nephrologist, we used to call him fondly Dr. R.C. Ladies and gentlemen, I really feel happy and privileged to be here as a participant and a guest lecturer for this meeting. Good evening to all. As our RC has told you, this World Kidney Day, it's an initiative started by International Society of Nephrology in 2006, mainly because to create awareness among the publics and general practitioners and physicians. Why they have focused on kidneys? See, as we all know, each and every organ in our body is important. What is the difference between kidney and other organs? Say, for example, most of our internal organs are earmarked for one dominant function. Say, for example, brain. So, main function is central processing unit. It controls everything. Heart pumps blood. Lungs makes us breathe. But what does this kidney do? Kidney is not only a unique organ, it is the most intelligent organ in our body. You know why? I will give you more information on why the kidney is the most intelligent organ in our body. Laser, because of the kidney. Osmolality and pH, that is the hydrogen. It is between 7.35 to 7.45. If any deviation happens to the pH change, life is not possible. I would say we often symbolize heart as symbolic as life. But the thing is, life is simply defined as chemistry or biochemistry. This chemistry is in balance because of the perfect kidney function. What happens when our kidneys are failed? So many things from head to foot. Each and every part of the human body is getting affected. Say, for example, brain is affected in so many ways, central nervous system, peripheral neuropathy, encephalopathy, so many things. And heart is getting affected, and we call it as uremic cardiomyopathy. Lungs are getting affected. So many, each and every system is getting affected. One of the most important signs of kidney damage is blood pressure. What we have to remember, any person less than 40 years, any elderly individual more than 65 years, if they develop blood pressure for the first time in their life, 90% it could be because of kidney disease. So this we have to remember. Any people, particularly young individuals, 20 years, 30 years, less than 40 years, first they have to check their kidney, whether kidney function is normal or not. Okay. Sir has mentioned already, nothing more to say from this slide. All over the world, the prevalence, the approximate prevalence of kidney disease is 10 to 15%. In India, recent studies, research shows 13% of our Indian population, they are having evidence of kidney disease, adult population. We have conducted, our institute have conducted a prevalence study on CKD in Chennai city. We also found that most of the Chennai adult population, 10 to 15% of our people having kidney disease, mainly because out of this 15%, 60 to 70% of the people are caused by diabetes and hypertension. And the most important thing, and Dr. M.K. Mani, we used to call him as Bhishma of nephrology. He often used to pass a comment. Kidney disease is one of the most debilitating disease because all the diseases takes away only the life. Kidney disease, the only disease which not only takes a human life, it also empties our pocket and purse. I said 60 to 70% of the kidney disease are caused by all over the world, not only in India, all over the world caused by diabetes and hypertension, stones and so other disorders. In the recent past 2-3 decades, a newer agent has been identified as one of the important or significant agent responsible for kidney damage. What is it? Our environment, our environmental agents. So many environmental agents are found to cause kidney disease. What are they? One, hot climate or extreme cold exposure, they can affect kidneys. Second, water scarcity and water contamination. The third, air pollution. As we all notoriously we believe, air pollution commonly affects lungs and precipitate asthma. Recently, studies from China has shown that even small dust exposure for quite long time, they can cause damage to the human kidney filters. So air pollution is also important, particularly very small particles. The fourth and important reason, mine workers, coal mine, gold mine, diamond mine workers, they are all getting exposed for so many dust. They are also more vulnerable for. So these are the various commonly observed environmental agents. They can adversely involve the kidneys. They can induce chronic kidney disease. Okay. How does this high temperature or humid climate affects the kidneys? The most important reason why kidneys are affected, once we are exposed to heat, lot of sweating happens. Because of this, generally in our, what are the evidences? These are all, you may wonder whether really all these facts are true or simple statements. No, it is true. It has been scientifically proven for the last since 1970. The first evidence or the research which has linked the evidence between the environmental factors of kidney damage has come from African, a research study from South African gold miners. Subsequently, from India, we have observed kidney damage among the farmers, construction workers, and sugarcane field workers. They are also found to have acute kidney injury and chronic kidney damage because of heat stress. In addition to that, they fail to take water while working in the field. Failing to take water while working in the hot atmosphere, it again precipitates kidney damage. So these are the various hotspots. The CKDU, that is kidney damage due to this heat stress or temperature changes observed in various spots like Central America, Sri Lanka, India, and Egypt. They are called global hotspots. So in India, what are the hotspots where this CKD has been identified? One is in Andhra Pradesh, a place called Udanam. So many patients working in that area, they had developed kidney damage. In northern part of Shimoga district of Karnataka, they have also documented so many patients of chronic kidney disease. And in Odisha, and in Tamil Nadu, Kadalur, Pandruti, Viluppuram, Perambalur, Ariyalur district, particularly farmers, where lot of people are working in the field without taking much water or without taking in between, they have to take some rest. So if you don't do rest or take shelters between a shade or don't consume adequate waters, at last they will develop kidney disease, particularly when they have diabetes or hypertension. So it is our responsibility as a community member, whenever people are working under us or in our field, we can advise them to take frequent water intake to avoid dehydration. This is the one. It's a research which our institute has conducted 2 years before. This study, we used to call this as CKD Agri study. This study was published in the Lancet journal last year, September 2025. What we did from Madras Medical College, we have taken samples from patients all over Tamil Nadu. We have divided the entire Tamil Nadu into 5 zones, north, east, west, south, and central Tamil Nadu. We have collected samples from 3,500 farmers. Out of these 3,500 farmers, we found 5% of people had evidence of kidney damage. So we have conveyed this information to the government of Tamil Nadu to plan a program or policy from the agriculture department to safeguard the kidney health of the farmer population. Okay. Who are all the risk? Only farmers, mine workers, construction workers, even the traffic police. We all used to see when we are traveling in the street. So many people are, traffic police constables are standing without taking much water. They are also more vulnerable to develop kidney disease. And street vendors, they are also more vulnerable, and sanitation workers. They are the group more vulnerable for kidney damage out of this hot climate. Okay. Apart from the temperature fluctuations, hot and humid climate, as I mentioned already, air pollution not only damages the lungs, it can also activate our own immune system to damage our kidneys. Thereby, it can cause protein leak. This continuous protein leak over a period of many years ultimately damages the kidneys. So this is how the fine particles, particulate matters less than 2.5 micrometer, They can enter through lungs, then ultimately enters the blood circulation, then activate our own immune system to fight against our own kidney. Thereby it causes kidney damage. Okay, contaminated water, as you all know very well, it's needless to say, infection, contaminated water, the cholera and all caused by contaminated water. It is the responsibility of the government and community to ensure that the people in a country or nation or state to get adequate water supply and clean and safe water supply. And not only the infection and high levels of salt, sodium, calcium and magnesium, over a period of long-term exposure to these kind of salt can cause kidney stones. They can, ultimately kidney stones can damage the kidneys. Okay, cold weather. You may wonder how cold weather can damage the kidneys. Yes, by two mechanisms. One, in people who are living in cold climate, basically they have less thirst sensation. They forget to take adequate amount of water. Think that in cold climate they don't take adequate water. That is one reason. Another important thing, when we are exposed to cold, our blood vessels are getting shrunken. So because of that, the blood circulation to the heart and kidney, that way I hope many of you heard about one common clinical situation which we are facing. Some of our friends or relatives or people, when they are walking or jogging in a cold climate like Kodaikanal or Ooty, they may get immediate heart attacks and die. That is because of vessel contraction. Blood vessels goes for spasm. So if this happens to kidneys, then kidneys also can go for acute shutdown. So that is why even extremes, maintaining the normal temperature or a medium temperature is always safe. Extreme temperature exposure, hot climate and extreme cold, both are not good for kidney health. Okay, having known all this information, how to detect? So the simple thing, from the patients or people may say, they can get swelling of legs, swelling of face, frothy urine. This is the very commonest symptom. Urine, doctor, urine naraya poittu romba nalla. Immediately you have to check urine protein, because that is the one common reason people may get frothy urine. Third, even sometimes passing urine in black color or in blood or red color. That is also one sign of leakage of blood or red blood cells in the urine. That is also an evidence of kidney damage. And persistent fatigue, tiredness. Always some patients, they often say, doctor, எப்பவுமே எனக்கு ஒரே டயர்டா இருந்துட்டு இருக்கு. நான் நிறைய சாப்பிடுறேன், நல்லா எடுத்துக்கிறேன், ஆனாலும் எனக்கு tiredness குறையல. So in those patients, you have to check the hemoglobin, you have to check the blood pressure. If you found anything abnormal, please refer them to a physician or a nephrologist to diagnose whether the given patient having any kidney disease or not. So once you have all these symptoms, then you can refer them to the physicians and they will do the necessary test, the simple test, urine protein test and serum blood creatinine test. These two things are enough, and blood pressure is on the higher side. It's a good sign of kidney disease. So once you detect all these things, you can go for ultrasound. It's a simple test that will give idea about whether the kidneys are in a good condition, whether it is smaller in size or bigger in size, or whether maintains a normal size. All these things we can get information from the ultrasound. So these are the very basic tests which, by using this test, simply we can pick up the kidney disease in the early stage. Okay. Prevention, this is the most important aspect. This is the main agenda or aim of the initiative of World Kidney Day. So each and every one of us can act, first of all, to prevent kidney damage in us and our neighbors and for the country. So what we can do at an individual level? One, as I mentioned already, Dr. R.C. also have mentioned, please never ever forget, the leading causes of kidney damage in the world, diabetes and hypertension. 60 to 70% of kidney damage is caused by diabetes and hypertension. Whoever has diabetes and hypertension, please ensure that your HbA1c is less than 7, or your blood pressure is less than 120/80, or at least keep below 130/80. This is the normal. Every day nowadays, say no, you need not go to a doctor or clinic to check your blood pressure. BP apparatus are available in every pharmacy. Even in Amazon, it is available for 1,000 rupees or 1,500. People who are having blood pressure, please check your blood pressure on daily basis. Ideally, come home before you take coffee or tea. Rest for a few minutes, 5 minutes or 10 minutes, and check your blood pressure. And accordingly, meet your doctor and adjust the BP medications. And many of us, we believe, once doctors prescribe medicines for BP and sugar, without going for review, we keep on taking the medicines for so many years. See, we do come across a lot of patients. where they don't come for follow. This is total ignorance. Just meet a doctor once in 3 months or once in 6 months. Ensure that your HbA1c is normal or BP is under control, so that we can prevent the killing problems. ESRD, end-stage renal disease is not a simple problem. Once any patient develops, only 3 treatment options are available right now. One, peritoneal dialysis. You can do dialysis at your stomach. Second thing, lifelong hemodialysis. Third is the transplant. Every form of treatment is initial investment and recurring expenses. That is the worst problem scenario every family faces. See, I do come across a lot of patients, very rich people. They at last, once their money or financial status exhausted, they approach us. They come to government hospital GH. See, I have recently, I had a patient who came from Coimbatore. He was running a jewelry shop. He had only one son. He developed end-stage renal disease. They have no suitable donor. He was keep on doing dialysis for 10 years, 15 years. They spent all the money. Ultimately, no money at all. Even they are suffering to have food and other things. Then they approached us, and we are helping them. So the thing is, these kind of financial burden can be totally, we can prevent if you simply take care of your blood sugar and BP. Once you are detected to have BP and sugar, ensure that simple thing, you yourself can monitor. See, glucometer you can buy a glucometer. You yourself can prick and check the blood sugar level. Simple thing. Once you are not confident, you are unable to come to a conclusion, then you meet a doctor. But even otherwise, once in a year, people who are beyond 40 years, in my suggestion, in my opinion, being a government doctor, seeing lot of kidney and heart disease patients, once in a year beyond 40 years, master health checkup is very important. Mandatory. You can pick up well. See, sir has mentioned, we all know as a nephrologist know, the Japan government has made it as a government policy to screen the urine and blood for creatinine compulsory for school admission. So without these tests, you will not get admission in a school. So like this, our government also, we are here, we can recommend all these things to the government so that we can also include such kind of health policies. Sir has shown so many pictures of cystinosis children. They can have a good, normal, healthy life once you detect in the early years of age. Sorry. So the thing is, most important thing, control blood pressure, diabetes, hypertension, eat healthy and balanced diet. Adequate hydration is very important. Here I want to say one more thing. Many patients or people, they use toss me. Doctor, thanni nariya kudinga, 5 liter kudikalaman kekkuran. 5 liters kudijana kidney problem. No, it's a wrong fact and information. The thing is, again, the workload to the kidneys will be more. See, the thing, whatever we eat or drink, it will come out of the body by 2 things. One is by motion, another is one by urine. When you drink too much of water, again kidney cells, they have to work more. So the cells will get tired. They will undergo apoptosis. That means physiological death. Then again kidney will get damaged. So the nominal moderate amount would be sufficient. Ensure that you are drinking water 2.5 to 3 liters would be sufficient. Fair enough. And one more important thing, and particularly I'm not giving as an other intention. In my practical clinical experience, women, they don't drink sufficient water. They always assumes that they are drinking 2 liters, 3 liters. I always inform each and every one of my female patients, madam, please measure your water intake. 2 liters or 3 liters. Keep a separate bottle, 1 liter bottle or 3 bottles, keep it with you. Then drink everything in 24 hours. That is the best way. Ensure that you are drinking 3 waters, because we always think that we are taking 2 tumblers, 3 tumblers, we are coming to a conclusion that we consumed 3 liters. It's not correct. You have to measure and drink. That is the best way. So the thing is, 2 to 3 liters of water is enough. Suppose you are traveling somewhere, we are getting exposed to more hot climates, drink half liter or 1 liter extra water, nothing wrong, only when you are getting exposed. And safe water and clean water is very important. Hope everybody is aware about it. And encourage timely rehydration. People who are getting lot of vomiting and diarrhea, please immediately take them to the nearby general clinic. General practice would be enough, because diarrhea can cause acute shutdown of the kidneys. People who are having diabetes and hypertension, if they develop diarrhea, then they will go for permanent kidney damage. So immediately, whenever patients are having, people or our family members or relatives, whenever they are having some vomiting or diarrhea, treat immediately. Just fluid replacement is enough, more than sufficient. Okay. So encourage hydration, particularly this is very important thing. Again, we all have elders in our family, because again they often forget to drink adequate water. Encourage, or intentionally we have to approach them and give them adequate water intake for our elderly people, and spread awareness. Suppose if you are living in an apartment complex, you can invite some hospitals, nearby hospital, to conduct a health screening camps. You can do your BP check, HbA1c, urea, creatinine, hemoglobin, all these things, and regular health checkups. Okay, what can the government do? See, these are all, as a government agency, we do recurring recommendations to the government, and recently we have, see, because RC sir knows, dialysis, almost all the corporate hospitals now they are doing single-use dialysis, that is disposable dialysis and kidney. We have also recommended the same policy. The cost is around 4,000 to 5,000 rupees. Corporate hospitals are charging. All the consumables required for dialysis in a private hospital comes around 4,000 to 5,000 rupees, because if you reuse the same items, people are more vulnerable for hepatitis B or C infections. To avoid that, all the hospitals have changed their policy. The same thing we have recommended, and government has agreed to introduce the same thing even in government hospitals also. So act today. I request each and every one of you, take care of your sugar and blood pressure. Drink minimum 2 to 3 liters of water every day, and inform your neighbors or relatives or workers to take adequate water intake, and spread awareness, and do undergo health checkup once in a year, especially after 40 years of age. So take away, same, kidneys are vital organ. Heat and pollution affects the kidneys. Dehydration is very dangerous, particularly in diabetes and hypertension individuals, and prevention is very much possible. We can prevent kidney disease, end-stage kidney disease. We can avoid dialysis and kidney transplant. Thank you so much.